Hi, I'm Dr. Kristen Barnes. I'm a GP practitioner here at Dr. Marina's Upgrade Subit Inc. I've been a GP now for the last 2 years. I received my degree at the University of the Free State, COFSIS, in 2020. Did my internship in George Hospital and my ComServe here at Aberdeen Hospital in the rural ECK. Initially, born in Bloemfontein and now I'm born on the West Coast.
Really now?
Yes.
Oh wow, okay. I
Yes.
moved here like 3 years ago.
3 years ago, wow.
From Cape Town.
Oh, nice.
Yeah,
I'm so glad to have made it to the Western Cape.
Yeah, I came for my daughter's schooling and she just came out of Cape Town.
Okay.
Yeah.
Amazing.
So today we're going to be talking about breast cancer awareness, and I just have a few questions.
Yes.
Let's start with what the common misconceptions are about breast cancer. And just a little bit of warning for young women and why they feel they are immune to breast cancer at a young age.
Yes, okay,
Yeah.
yes. Definitely, it's something that can happen at any age. It's not something that happens to menopausal women or later in life. And that is why it's so important that we actually advocate for early detection and early prevention, because that's actually what saves you if you are unfortunately diagnosed with cancer. The earlier we catch it, the earlier we can treat it. And it, like I said, it has no discrimination in age. If there is especially a very strong family history, so let's say your mother, your aunt, your grandmother had, your chances of having is also very, very good, even at a young age. From when women hit puberty, actually, you're already being exposed to estrogen and all those hormones that can lead to cancer cells growing. So technically, even the moment you actually start with your period, girls are already actually at risk, which is scary to think of. But due to the hormones in our bodies, it can happen. So it is something that even if you're very young, just make sure you are keeping up with checking yourself, knowing how your breasts look, how they normally feel, and just if you are concerned and see something that's worrying, doesn't matter what age, just to have it checked out and just be sure. Another misconception is men. People think men don't actually get breast cancer, but they have the same tissue as women. It's the same breast tissue, so they are also subjected to being able to get, hormone, we call it hormone receptor breast cancer, and they can also actually get it. So men also are very important to also self-check, make sure they don't feel any lumps and bumps and things like that, which I think some men also think, oh, they're not going to get it, it's a woman's disease. But unfortunately, it's also not the case. And with men, then, due to that, we actually pick it up too late.
Oh wow, okay, I didn't know that. Right. And then, so you explained that how old is no age?
No,
from
unfortunately,
puberty.
Pretty much from puberty, actually, yes. When your breasts start developing and the hormones start taking over, we need to check then, yes.
So, just out of interest, what was the youngest patient you've seen?
The youngest patient I've seen was actually 23 years old.
Wow, that's very young.
Yes, but she also had a very strong family history. So her aunts and mother actually pushed her to have regular checkups, and that's why we were actually able to pick it up quite early.
Quite early.
But it can happen, yes.
Okay. And then, why would you think people, let's say someone my age who's 50 already, would put off going for a mammogram?
Obviously, we are women and we all talk. And I think it's not a very pleasant process, to be honest. I mean, it's an uncomfortable process. You have to get naked in front of someone that you don't know. It's quite a scary machine that you now need to, place your breast into, and it's an uncomfortable process. And some women actually find it painful because it's actually compressing the breast to take the imaging. So, that is out there that everyone says it's not nice, it's uncomfortable, it's painful. So you don't want to actually put yourself through that, I think. And also, I think it's almost a bit of, in a way, denial, especially if they do find something. So kind of if you put it off and you don't want to go and do it, and maybe they find something or not, you kind of in a safe space things, you don't think it's going to happen to you.
Yeah. And then, let's say someone is very small breasted, let's say like me. I mean, for me, that's one of the biggest fears. Like, I'm going to go there. What are they possibly going to be squishing?
Yes.
So,
luckily the mammogram plates themselves come in all different sizes. So they go from AAAs until triple Gs. So there's different plate sizes that actually use on the mammogram machine. So it doesn't actually matter what size, they do still are able to do it. There's even women that have had bilateral mastectomies that still get mammograms because the plate can still pick it up.
It's incredible.
It's really, the technology has grown so much over the past few years. And then let's say, for example, the mammogram isn't successful for some other reason. Maybe there's breast density that's a bit too thick, or they're not really sure. Then they actually also do then an ultrasound, kind of like with the pregnant women. But then they actually ultrasound the breast tissue, and then that way they can also make sure if there's any lumps or anything to be concerned about.
Okay. So my daughter, when I spoke to her about breast cancer awareness, and I'm doing this interview, and I want to go for a mammogram, and she was so interested in the topic, and then she said to me, "Mommy, but I've got I've got a lump in my breast," and I thought, and I was dismissing her, and I said, "Well, you're too young, whatever," but she already has her period. So now that you're saying it, I'm like, oh, okay, maybe.
Yes, but unfortunately, or fortunately, not all lumps are cancer. Like I said, our breasts are actually controlled with our hormones. So especially when your period starts and you're going through those different phases of your estrogen and progesterone levels that are lowering and increasing during the cycle, you do get nodules and tenderness of your breasts as your body has been subjected to the estrogen levels that are rising and falling. So sometimes it's a normal response in your body just to have a small gland or a duct that is receptive to that, and so you do get them growing bigger and smaller during the cycle. But it's good always just to check it out and make sure that it is just that and not something else.
And then I was wondering, is breast cancer actually avoidable? Can you avoid it?
So there's obviously things that you can do lifestyle-wise that will obviously reduce your chances. So obviously living a healthy lifestyle, diet, exercise, looking after yourself, not using alcohol and over consuming alcohol, exposure with cigarettes and things like that. Obviously that will reduce your chances. And also having regular checks and things like that. But unfortunately, like I said, if you have a family history, and we actually have done, there's certain studies that have been done to show there's BRCA1 and BRCA2 genes in females, which actually predisposes you to cancer. So obviously if you do have that, your chances are very, very good. So what you as a person can do is just to look after yourself, make sure you're the healthiest possible, and just to be aware of your family history and just make sure you pick it up early. But otherwise, you can live the most healthy lifestyle, but if your genes are just against you, unfortunately, there's nothing you can do.
Okay. And then, is there any advice you would want to offer women, just to sort of put them at ease, or to, get them out there?
Yes.
Or,
Yes, obviously, breast cancer is scary, and we hear more and more about it lately because obviously it's becoming a common illness, unfortunately. But it's something that we kind of have to get the stigma away from. We all have breasts. We need to become comfortable talking about it, asking friends about it, making sure we check up with that. And it's so easy, just once a month, to stand in the shower, just to feel around, do your self-examination, look in the mirror, and just make sure everything looks okay. Just to get into that habit. I think, you hear the horror stories and you're scared, but it doesn't always have to be that way. And especially if you're comfortable with your breast and you know what's normal for you, and to be able to pick up any anomalies quickly, it's really something that can make this disease not as scary. And if we take the stigma away, it's going to get much better.
And you mentioned now that's becoming more common. What is that so?
I think it's because people are getting into all the technology nowadays is much better. So we are picking it up easier and less advanced. So we are picking it up in the early stages. And I think more and more women are aware and want to take control of their health. So more and more are going earlier for screenings and for everything. And I think unfortunately that means we are picking up more. So the statistics show that there is more. But it does mean at least that we are picking it up earlier. So treatment rates are also much better.
So what would be your first line of treatment? Or would that depend on the stage where you're at?
Yes, obviously. So obviously everyone begins at home. So obviously with self-inspection and everything you see. Then the next step would be, if you do find something and you're concerned, is to obviously go see your GP. or at your local clinic, the sister, so that someone can just have a look and make sure if further testing or imaging is necessary. Going from there, usually a biopsy is then recommended to see what type of cancer it is, if the cancer has been diagnosed. And then taking it from there, because there's actually many different types of breast cancer. I know everyone just talks about breast cancer, but there's specific types. So there's hormone receptive breast cancer, there's inflammatory breast cancer, there's ductal cancer, so there's a few. So finding out what type you have specifically, and then obviously the different treatment options that are then available. It doesn't have to be straight mastectomy. I know everyone is scared of that, and it's not nice as a woman to lose your breasts. I mean, it's not a vanity thing, but it's what makes us, you know, and especially if you're a mom and you breastfed and everything. I mean, it's a journey that the breasts, you know, all of us are very excited to get our first bras and everything. So it's a part of us, and it doesn't have to be a mastectomy straight away that you're going to think you're going to lose that. I mean, the radiation therapies and the chemotherapies have come such a long way that you don't have to go to the extremes anymore.
And pregnant women, you know, when you're pregnant and you discover something like that, perhaps during your pregnancy, I mean, does it happen? What do they do for them then?
Yeah, so it can happen, unfortunately. Not just with breast, also with cervical cancer. You can actually pick up if you're pregnant, and if that does happen, usually what they would do is, depending on what type, they would usually, you know, hold on treatment until the baby is born, just to be safe. But mostly, you know, there is treatment that can be given during pregnancy if need be. But it is something that you can pick up even while pregnant. And your breasts undergo a lot of changes when you're pregnant, with the ducts now becoming active and to produce milk and everything. So that is sometimes when we actually do pick it up the most, because you can actually see the changes then that were lying dormant.
It must be so scary.
Especially going to pregnant,
and you still have to go deal with that at the same time.
Exactly, no. So it's not very nice when it happens, but it has happened. But you know, treatment is then still successful, and we always also look out for the baby's health, of course. So we won't subject you to treatment that's going to harm the baby. So it's a difficult situation, that especially, but it has been done.
Okay. I think I've gone through everything. Okay. Yeah. I think
is there something you maybe would like more clarity on, or some other questions you were maybe thinking of?
If there's anything you would like to share, I think you've answered all my questions, but if there's anything you would still like to share on the topic.
Yeah, just always, I always just tell my patients as well, hand in hand, you know, is mammograms, very important, but pap smears too. I know breast cancer month, but pap smears, I know it's also not a very lovely process to go through, but it is also something that needs to be done every 3 years if everything is clean. So luckily it's not a yearly thing. But yeah, usually if we pick it up early, the chances of getting through it and staying healthy is really, really, really good.
It's so strange that you mentioned pap smear. I don't know where my daughter heard the word, or she's 12.
Oh wow, okay, I love that. She actually knows so much at 12.
And then she asked me, you know, what it is, what does it feel like? And I was like, I don't even know how to start explaining this to a 12-year-old, you know. But anyway, I suppose a girl mom, you have to find ways to talk about it.
Exactly. And luckily, like I said, also technology has advanced. So it's not those olden day scrapes that used to be so painful and uncomfortable, and a speculum that used to be that metal one that's ice cold. I mean, we don't use that anymore. So the process has become much more comfortable for the woman, and like I said, every 3 years. It's not now that you have to subject yourself, you know, regularly. But if we do find something, obviously we have to increase the frequencies of that. And they actually also do recommend that women that have become sexually active, and I mean in South Africa we've got 11, 12-year-olds pregnant at this stage already, so it is important to at least be open with the daughters and the sisters, and just be like, if you start being sexually active, just have your pap smear done and just know everything is okay, because again, it is something that is preventable.
Yeah, or treatable.
And treatable, exactly. Yes, exactly. The earlier we